So this is a standard laceration tray that you'll find in most ERs. Every hospital stocks different ones, so familiarize yourself with what your ER has. An easy way to know what is in the kit, and I didn't know this for years because I never paid attention, was that there's a list on the actual packaging before you open it that tells you exactly what's in there. And this way you know what needles are in there. Some kits do not have a syringe or needles in them. This kit does. So make sure you know all of this before you go see that patient, or before you're ready to repair the laceration, so you're not running back and forth gathering more supplies. So typically you'll get some gauze. I always bring extra gauze when I'm doing a laceration repair. Typically this isn't enough. You'll have a fenestrated drape. This is a drape that has the hole in the center that you put over the patient or over the wound. And typically you get a couple more drapes. Now for the instruments, most laceration trays will have a hemostat. I don't use this often. If I'm doing an incision and drainage, I'll use this to gently break down the loculations or dissect a little bit of the tissue. Or if I have a bleeding blood vessel, I can clamp it while I continue to work. Of course, the forceps, this is of course to grab the skin. Sometimes you can use it to pull out foreign bodies. You have your needle driver, which is essential. Your scissors, and if your kit has needles and a syringe, typically you get a few sizes. So you're going to get a large one so that you can pull out the lidocaine, and then you're going to get typically like a 27 gauge so you can deliver that anesthetic or infiltrate that anesthetic locally. I typically grab a long 27 gauge with me just so I can have it. If it's a large wound, typically these short little needles aren't going to reach my wound, so I just always bring a long 27 gauge with me just so that I have an extra needle with me. These little cups are very typical. I never use them. And that's pretty much it. This is your standard laceration tray that you'll find in most emergency rooms.